I think that's it before we dive in. So we just want to thank you so much for being part of our DCA family. We really appreciate it. And I hope you enjoy this topic. So what are we going to be talking about today? We are talking about pigment. And that can be reds or browns. So you might be splotchy or blotchy or speckled or spotted. When I wrote all those things down, I kind of laughed because it kind of sounds like Snow White's orphan dwarfs, don't you think? I don't know. Anyway, it's goofy, but it's true. You can get really frustrated with all those types of pigment issues. And I think there's a ton of different causes for uneven skin tone. And it's really important when we start talking about colors like reds and browns that you understand we're talking about control versus cure. And you know, it's so much easier sometimes when you have, like, let's say an infection and we can give you an antibiotic and it's just done. Reds and browns, there's things that you can do to help control, to push it back a little bit, but then you've got to maintain it. And usually you'll have to do something again to kind of keep those things quiet. So we'll get into all that in a second. The way I kind of think about this too is what we're going to be talking about is with the skin in general. I often use the analogy of a lumpy, bumpy mattress and a wrinkled, stained sheet. So fixing your mattress is kind of the things that we'll do with Botox and fillers to make things smooth down there. The sheet represents your skin. And when we want to have ideally a nice, firm, crisp mattress and an ironed, starched white sheet. And so ironing the sheet is helping texture. Bleaching that sheet and making it nice and white is what we're going to be talking about today. How do you kind of clean up those reds, clean up those browns, clean up those stains so the skin looks fresh and just rejuvenated and more youthful. So what are the issues that you can have when we're talking about this? So we'll start with the reds because I think they're kind of, there's not as many causes of that, a little bit easier. One of the biggest causes with reds is just an underlying redness where people flush or they blush and they just notice diffuse redness. A lot of times this gets worse through the years. You might be the first one to turn red on an exercise class, or maybe your redness lasts a little bit longer than everybody else's after anything that makes you flush or blush. So that's typically rosacea. We're going to have a lot of pictures, I should tell you today too. So the first picture we will show you that Allison's going to put up is for a rosacea patient. You can see she just has some diffuse redness kind of everywhere. That's pretty typical. Other causes of reds, spider veins and broken blood vessels. Some people have those as well. And that's usually the ones that you'll see kind of around the nose or the chin area, the cheek. And then there's also something called post-inflammatory erythema, or we call it PIE for short. And this is a type of redness that you'll usually see after some type of inflammation. Say you've had maybe an acne pimple, or maybe some kind of inflammation, even an insect bite, and your skin just turns red and you hold on to that red. So that can be a cause of kind of a blotchy pigmentation. So we're going to move on to the browns, and that's a much bigger category, and that's probably the thing that frustrates a lot of people. And I'm going to go over kind of briefly the different things that can cause these browns. So freckles, you can have freckles, and these are a combination of things that are caused from genetics and from the sun. Freckles tend to be smaller, they show up in younger patients, and they tend to fade a little bit in winter. So picture, the next picture, Allison, we have a little girl with freckles, and that's fairly typical. A lot of people love their freckles, and there's nothing wrong with that. And if you want to keep your freckles, if you're undergoing any treatments, it's important to let us know that, because some of the treatments that we do will take away your freckles. So if you love your freckles, there's ways sometimes to lighten the skin without affecting those as much. So we'll talk you through that. Let's talk a little bit too about melasma. And actually before that, I'm sorry, let me talk about lentigos. So lentigos are, so freckles and lentigos are sunspots. What's the difference? I get that question a lot. The sunspots tend to be a little bit larger. They tend to come up more with age in sun, and they don't tend to fade as much in the winter, so they persist a little bit more. So we have a couple of pictures as well. Allison, if you'll grab those, the pictures 6 and 7 have some bigger, larger lentigos or sunspots. A lot of people really dislike those, and so those are things that are kind of fun to treat as well. Another cause of pigment issues, melasma, or the mask of pregnancy. So that is something that is caused usually by hormones. There are larger splotches, typically on the chin, the upper lip, maybe the forehead, the cheeks. 90% of people who get it are female, so 10% are male. So it's not 100% hormones, but mostly hormonally influenced. A lot of times coming up with pregnancy or birth control. The cruddy part is that you can't just stop your birth control and the pigment goes away. Unfortunately, once it's there, it's kind of there, and so you are, again, trying to control it versus cure it. Melasma can be either epidermal, dermal, or mixed, and what that means is epidermal pigment, just in general, epidermal pigment is easier to treat. That's higher up in the skin. You have a better shot of really making that look better faster. Dermal pigment tends to be a bit deeper, and it tends to be a lot more stubborn. And that's the type of pigment too you don't want to go after hard and heavy, because if you're too aggressive with it, you can actually make it worse. Sometimes a lot of times with melasma especially, you can have mixed pigment where you have a little bit of the epidermal and the dermal. So melasma, I think out of all the types of pigment, tends to be the most stubborn, and you have to be very patient and cautious when you're treating it. And then lastly, I would be remiss if I did not mention melanoma. So, this is not something typically we would see on our face, but you can. But I just want to mention that melanomas are usually really dark spots. So, we all have moles and freckles and sunspots, etc. If you do have one that just stands out to you, I just call it the brain tickle. Maybe it's just darker than the other ones. It's bigger. Maybe it's bleeding. Definitely get it checked out. We talk about the A, B, C, D, E's of melanoma. So there's asymmetry, if you have a irregular shape to it, if the border's jagged, if the color's, again, very dark, if it's getting bigger, and it just doesn't fit in. Those are things that you really want us to look at as well. So just a little PSA on that. Okay, so let's move on to treatment. How do you treat let's talk about the reds first. And, with the reds, I'll start off with just what you can do at home. A lot of times it is topical things that you're going to look for sensitive skin products. And actually, I'm not going to dive super deep into this because we're going to talk about this in our skincare noon Zoom. And so that will give us a lot more information about what you can do. And we'll talk about different things that you can do at home for different skin types at that. But I will mention with rosacea, a lot of times you do need to use a prescription product. So especially if your reds have a pimple component to it, you really probably need to see us, and we can kind of talk you through some prescription options. There's topical products and there's oral products that I think can definitely help. Sometimes they're actually useful in combination with some of the procedures we're about to talk about. So procedures, what can you do? You have to be very careful with the reds because people with red skin or broken blood vessels tend to have more sensitive skin, so you want to be gentle. Hydrofacials actually are nice just for kind of that diffuse redness. We have, there's different boosters that you can add to hydrofacials, so whether maybe you struggle with acne or you just have the diffuse redness and you want something to calm the skin, that might be a nice option for you. If you want to be a little bit more aggressive, or you have those, the vessels, the spider veins and vessels on your face, the hydrofacial, I'll be honest, is not going to help that much, but you'll really need to do a laser. And the V-beam laser, to me, is the gold standard. It's a pulse dye laser. That's the type of laser it is. It's a single wavelength of light that really helps to clear up those vessels. It can take several treatments, and you might have to redo it at some point. So some of this depends on, again, your DNA, your genetics. How red are you? How red's your mom, your dad? How many broken vessels do they have? And that kind of will determine how frequently you would need to retreat once you get treated with the V-beam. Okay, so that's kind of reds very briefly. I do want to spend a little bit more time though on the browns, because I think that's the thing that frustrates a lot more people. And there's a lot more options. And when we start talking about the browns and what you can do, I'm going to talk to you kind of about a therapeutic ladder. And what I mean by that is there's different options. At the very bottom rung of this ladder are just things that you would do at home. Say sunscreens, maybe a topical bleach. And will that help your dark spots? Is it going to be fast? No, you're going to have to do it over time. Do you have a lot of risks? Is it super expensive? Do you have a lot of downtime? Not at all. At the very top rung of the ladder would be something like, we don't even offer it here, but like a super aggressive CO2 laser. Is that going to give you a really fast, beautiful, quick response? Yes. Is there a lot of downtime? Yes. Risk? Yes. Expense? Yes. A lot of people don't need that, but the thing is we're going to talk about things in the middle too, but you just have to make sure you set your expectations correctly. So for instance, you don't want to say, I'm going to be using my sunscreen every day and expect to see a CO2 laser result, because you're going to be disappointed. So we want to make sure, and I'll kind of walk you up the ladder, you want to make sure that your expectations are set correctly. And then also, who are you? Some people, like, I'm a dip your toe in kind of girl. Like, I kind of like to see, well, let me try the easy thing and see if that works. If that doesn't work, I'll get a little bit more aggressive, and I kind of move up that way. Other people are just like, no, I am one and done. Let me just kind of try and hit this as accurate as I can and just get there as fast as I can. Either way is perfectly fine, but I just think you have to realize that there are, again, different levels as far as what you can achieve with these different procedures. So let's dive in. Again, with the over-the-counter things or the things that you're going to do at home, we're going to dive into that at our skincare talk. So I'll just briefly touch on it. I will tell you, if you're struggling with pigment, at a minimum, you need to be using an SPF 40, 50 plus, because the 30s I just don't think are enough. It needs to be daily. I cannot stress this enough, because if you are here and you're about to spend time, money, and effort on your skin, on your pigment, you have got to protect your results. So the sunscreens first and foremost. If that's not a habit for you now, start now, so that if you decide to do something in the future, you already have set that standard. There are some prescription bleats. Hydroquinones are wonderful. There's some non-hydroquinone skin lighteners as well. And we'll get all into that in our skincare talk. So let's move up a rung. So if you said, okay, well, I'm doing the over-the-counter stuff, and that's fine, but I want to be a little bit more aggressive. What else can I do? You can try things like, again, I'm going to go back to the hydrofacial, because I told you there's boosters in the hydrofacial. So specifically, there's one for pigment called Brightenol. It has some alpha-arbutin in it, some bearberry extract, vitamin C, and it's just a nice skin brightener. You can get a very nice moderate response with that. That's going to take usually several treatments, so usually maybe about 4-ish or so. There's no downtime with the hydrofacial, so it's really quick and easy. Staying on that kind of lower rung of that therapeutic ladder, let's talk about some light chemical peels. So we offer several different ones, and that really is a conversation between you and your esthetician, and they'll kind of help guide you as far as where to start and how to progress through them. So there are several different ones. I don't want to get really caught up in the nomenclature of these lighter types of peels, but I will tell you that, again, done in a series, they can be helpful as well. We do have some pictures of those as well. If you can pull those up, Allison. We actually, there's one that, I think the first one is for melasma, and that's a really nice picture. This is after five peels, and that's kind of typical. You want to go kind of low and slow with melasma. You don't want to push too hard. Again, if you over peel or you get too aggressive with melasma, it actually can get worse. So we want to be really careful. The next picture for the lighter peel actually just shows more general sun damage with those lentigos and sunspots, and I think that's a nice result in a little bit more mature patient. Okay, so what else can you do, especially with those sunspots, again, staying fairly conservative? You could just freeze them with something called liquid nitrogen. We do this a lot for precancers, but we can do this for sunspots as well. That's if you really just are one of these people like, that's great, and I understand everything you're saying, but I have one spot or two spots and they drive me crazy. Just freeze them. It's pretty inexpensive. The downtime's not too bad. I do tell people try to do this in the fall and winter so you can protect your skin as it heals. So I think we have a picture of that as well. Just in that picture, you can see how we freeze. You get a blister afterwards. There's a little bit of crust, and then it gets better. So sometimes it can take more than one treatment, so I will tell you that. But that's a really nice way to treat very isolated lesions. What else? Deeper peels. Let's move up to that. So now maybe you're someone who can tolerate a little bit of downtime. We have something called the Perfect Derma Peel, and you will have a few days of downtime with this one. The other ones are a little bit lighter, but you don't have to do them as much. So maybe, depending on your issue, anywhere from 1 to 3 treatments. I think we have a picture of that as well with a melasma patient. and that's before and after one treatment. So you can see fewer treatments, but a little bit more downtime is your trade-off with that. Okay, so let's move on to some laser treatments or light treatments. BBL is really one of our more popular treatments, especially for pigment, because you can treat not only the face, you can treat the neck, the chest, the arms, a lot of different areas in the body. You might have heard of IPL, photofacials, ours is BBL. They're all kind of the same thing. And these are multiple wavelengths of light that help to target pigment mostly. They can help a little bit with reds too, but really I find that they're most effective with the browns and especially with those sunspots. If you have melasma, you got to be super careful with the BBLs. Number one, because melasma can get worse with the BBL treatment, especially in the darker skin types. And you also have to be very, very careful. You cannot treat tanned skin. So do not lie about your sun exposure if you're coming in for BBL. If you've had too much, that's fine. We'll reschedule you. It is very important because what ends up happening is if you have tanned skin, that BBL will see that as target and you can get a much, much more brisk reaction than you actually intended to. So you really need to let us know if you have sun exposed skin. So I think we have a few pictures as well. Allison, if you can get the BBL pictures up. So I think we have this one picture, but this is a nice picture and really shows some nice clearance with a BBL treatment. And you can see how much brighter her skin is with those brown spots that are treated with the BBL. Okay, so let's move on to, for us at our practice, our top rung. So I'll be honest, we don't have, I don't like things that are super, super aggressive. I don't like to lose sleep over myself or my patients. And so Halo to me is a wonderful compromise of a more aggressive treatment, but works wonderfully. You get really, I think, phenomenal results, but there's not a ton of pain. You don't have a ton of downtime. There's just not a lot of risk like there are with some of the more aggressive lasers, and that's why I love the Halo. I've had it myself a couple of times, and I think it's just wonderful for pigment. It also helps with texture, so you are getting a little bit more boosted treatment with the Halo over the BBL. You may not need as many treatments with the Halo as well. I think we've got some wonderful pictures of that. Allison, if you can bring up a picture, I'll give you a second for that. We've got two pictures. One is a picture, and you can just see some improvement in just general sun damage. And I think that's a really nice result after a Halo. And then also for melasma. Halo, I like Halo better for melasma. I think it's a little bit safer in the right hands. Well, either way you split it, I think melasma can just be a difficult thing to treat. So, when we do treat any type of melasma, we're always going to pre-treat you and we're going to post-treat you with some topical therapeutics just to help you. And we're going to make sure you're wearing your sunscreen daily. Okay, so that is a very brief, but I think pretty thorough overview of the things that can affect pigment. And if you're struggling with pigment and you're interested in any of the things I've just talked about, but still are just confused about where do I start, I highly recommend you schedule a Visia with us. So Visias are cosmetic consultations done with one of our advanced skincare consultants where they take very occasionally humbling pictures of your skin. So there are regular pictures and there's ultraviolet pictures, and so it gives you kind of a grade against other women your age for things like your pigment, your brown spots, your red spots, but also your texture, your pore size, a bunch of different parameters. But knowledge is power. So if you know what your issues are, it kind of makes you a little bit more effective as far as what do you treat? Where do you start with your topicals? Where do you start with your procedures if you're thinking about them? And we'll help walk you through some of those decisions if you need help. If you decide already you want to do something, especially if it's a laser, you'll need a consultation for that, and you can just schedule a laser consultation with us as well. Okay, so on